Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We want to bring you the most practical CIO insights and perspectives. We know your job is challenging and we want to help your job be easier. And today we're at the HIMSS 2022 conference and we're here with Ray Lowe, Senior Vice President and CIO at AltaMed. Welcome, Ray.
Thank you, John. Big fan, long listener of Healthcare IT Today. You have a great point of view.
I appreciate that. Well, I'm excited to hear your perspectives and have you as part of the family. So tell us a little bit about your background and how you came to AltaMed.
Sure, so thank you. So I've been at AltaMed for 4 years. And prior to AltaMed, I'd worked at most of the large systems. I worked at Dignity Health for 8 years, where I ran infrastructure programs. I worked at Providence Health and Services. I ran large startup implementations. I also worked at Kaiser Permanente. I was actually there for 8 years and built some hospitals, built some cancer centers, et cetera. And I joined AltaMed in January of 2018, really to lead them onto their digital transformation journey. Not only from a technology perspective, but also an application and patient experience.
Well, it sounds like you've had a broad perspective across large institutions and very varying background. That's interesting. But as you look at your work, what's a problem you're working on that maybe not enough people are talking about?
Yeah, everybody's talking about data.
Okay.
I mean, data is the core of everything. It's the foundation of how you make your determinations, your decisions, how your EMR is going to formulate, et cetera, around there. I think there's a growing question when you acquire, because we grow and we acquire other clinics, et cetera, or even when you're moving an EMR. When we went from a previously legacy over to Epic, is how do we really work on that continuity of care? Because we want to know the patient, right? And when you're shifting it, we had to look for a solution that would natively integrate within the Epic platform with a single launch of a button for both medical records as well as dental, which is very tricky because there's a lot of imaging in that, and so that our providers can have just that continuous look without having to go search, go to HIM, et cetera, around there.
Interesting. So you have been working with Harmony Healthcare IT on some of that problem, right? So tell us about the challenge that prompted that and why you chose to go with Harmony Healthcare IT.
Well, you're going to take me back to September of 2019. Okay. So we actually had selected another provider. I was trying to do a 2-for-1 with a different provider that was doing some integration activities with the hospital system we were working with. Okay. And my assumption was that they would be able to help us with our data archive. We had a lot of issues with it. And so I had some relationships with the folks at Harmony, and I reached out to them and said, I need some help. And now my EMR is about to launch. I don't have data access, et cetera, around there. And we're federally qualified healthcare centers. So we're not funded with a lot of money, And so when you look at how do I make the decision, I go, I'm looking for a partner, right, that understands who I am, that can meet my needs for me as well. And to me, it's all about integrity and accountability. And actually the Harmony folks did do that for us. And we're able to stand them up in, I think, like 90 to 120 days, kind of in that time period, and it's gone very well.
That's great. So what was the big differentiator? Obviously they weren't delivering, so that's one
big one, right? Definitely make a change there, right?
Yeah, but what was the differentiator between the old partner and what you wanted to accomplish with Harmony?
Yeah, it's all about maturity, right? It's about maturity, it was about practice, through there. Again, it's been a few years since we had the conversation or selection, and again, I want information up front. So I had one of my directors that was actually working with them, and there were bumps that were happening, in there, and it's just part of the discovery process. But the Harmony folks were really upfront. They told us, they said, this is what we're going to do, this is how it's going to be managed. If there was a cost differential, it wasn't significant. And we were able to assess, can I still maintain this within budget? Again, you can imagine doing an Epic implementation and you've now gone live. Okay, I am now paying for my legacy system to be available for read-only access. So I had a very quick platform to move over there, or I was paying for multiple platforms, right?
Yeah, no one wants to do that.
Nobody wants to do it. No, that's not a good thing. Yeah.
Well, and I think it was interesting you mentioned the dental records piece.
Right.
I don't know many that do that. So was that a challenge, or how did that play out?
Yeah, dental orthodontic, pictures in there, and that's, when they take pictures of it, they kind of show it in terms of what's happening. So that's a record, right, you have in terms of your patient's mouth or what type of work has been done. So they would bring it up Again, being a federally qualified healthcare center, we do primary care as well as dental care. Again, for low-income, underserved markets,
it's kind of a unique situation.
Exactly, right. So you provide that access and you provide that quality of them. So the dental images, right, are part of their practice. So many of us talk about EMRs, right? We all get EMRs today, but the dental side is just kind of interesting. Like even Epic on Wisdom as well, the way that Wisdom works versus how we do it from an ambulatory perspective.
Yeah, it's definitely a challenge. I mean, it's interesting that at the Federally Qualified Health Center, you're able to bridge that gap. That's pretty cool. So let's talk about the Health Data Archiver from Harmony Healthcare IT. What was the impact on both like the clinical teams, but also on the HIM side?
Oh yeah, that's a great question. So, for the clinical team, my view is I don't want my clinicians to have to change systems, right? So it should be one click, and then you pull it off, and you're able to, address and see the trending information of the patient. Okay, and so we're able to achieve that single sign-on integration, so the doctors had ease of use.
Right, which is essential, or they won't use it.
Right, exactly.
That's awesome. Were there any other results you saw? I mean, I think people always go through that debate, the CIO. Should we get rid of the old one? Should we keep it? What were some of the benefits you saw of moving to an archive platform?
Well, I think you have to. I mean, the requirements of maintaining medical records. Again, the worst thing to have is a broken record. And sometimes people say you only need to look at the last 3 months of your lab, your pharmacy, as you're doing an EMR implementation. Usually load that in and pull the data, but you don't have the deep history behind folks. Again, our patient population, there's chronic diabetes, chronic CHF, chronic COPD. So it's really important to understand how the A1Cs have been trending and other clinical measurement factors. So again, getting that longer view in terms of.
Interesting. I would have never thought about a kind of archiving legacy application as really a population health platform, or at least an effort to ensure the quality of health in your population.
Well, again, population health, it's so key. I know you're also your big topic is on social determinants of health, and
absolutely.
Population health, social determinant health is one of our key initiatives. We can talk more about that later in there. But really kind of identifying the patients in there, who they are, how to outreach them. It's interesting because we're community based, right? And we're trusted by a patient population that doesn't necessarily speak English, right? And we're also part of a patient population that may or may not be citizens, right? They don't want to be identified around there. So you need to have this kind of continuation. So as you see the patient, right, you know where they're at, what they're at. You can see where they're trending, where they're improving, and you can demonstrate it.
Yeah, well, it just illustrates how important it is to have all that data available in an accessible format, not just we're still paying a license and no one accesses it.
Yeah, and again, when you look at the quality data, right, you want to see the year-over trend of the quality. You want to look at the quality improvements, the HEDIS measures. How are you extracting that? Health plans want to see what you're doing on a quarterly basis. But as you can, move ahead, and you see the trend as a patient. I love being able to look into my chart, right, and kind of see what I'm doing, how I'm doing. Exactly right. Yeah.
Well, let's shift gears a little. In our CIO podcast, we always love to give some career advice as well. And you've had a fascinating, career and background. But what advice would you share with other CIOs, maybe looking to embark on a data extraction and archiving project, or other advice for their career?
Wow. Well, one, do not be afraid of data. I think a lot of people get afraid of data, and they kind of may not act.
Is it afraid to look in the mirror and say, "Ooh, my baby's ugly," because the data's not quite right, or is that the feeling, or what's the?
Wow, that's a good one. I would never say that anybody's baby's ugly. That'd be kind of rough, John. But no, it's like, as organizations grow and you become more mature and you become more value-based and you become more quality-focused, right? The data is really important. Your executive team is going to want real-time data, right? We want to have decision support tied to the data, right? And so when you look at the mapping of the longitudinal data historically, as well as what's currently happening, you get those insights. It gets even more interesting, okay? So again, in our patient population, again, I'm going to talk a little about SDOH, and I'm going to talk about social vulnerability index. I'm going to talk a little bit now also about community-based organizations, right? So if you can overlay all that, and you really get a mapping, right, of where you have the food scarcity, what are the zip codes, who are the people, what almost down to the street level, and how do you partner with it, understand it.
Yeah, no, it's a challenging thing, but it's so important. So just wrapping up here, what's been one or maybe a couple keys to success in your career?
Oh, that's a good one. I think your personal integrity is what you stand by. Yeah, and I think as a leader, you need to be strong in who you are. I really also believe in the way that you treat people is so important. I'm on the golden rule. Of course, you need to have the technical competency.
Yeah.
As a CIO, you need to have the cybervigilance. I was at a previous talk today, and then somebody said, well, I go, how do I sleep? I said, I sleep like a baby because every 2 hours I wake up because I'm afraid there's some type of cyber threat around there. But more importantly, I think even the CIO, the letter I, has so many different interpretations. Most will tell you it's a chief information officer. But the reality of it, it's a chief information officer, it's a chief innovation officer, it's a chief clinical informaticist, and also it's influence. So you got to be able to do all four of those, and you kind of like balance as you lead your organization. In Becker's, they've had some conversations about the COO by proxy, because the CIO, the systems, and you can kind of see what's happening and how optimized, and potentially effective change that can have a tremendous outcome.
Yeah. Well, Ray, this was a fantastic discussion. I loved learning from you. I thank you for taking part in the CIO podcast. And thanks everyone for watching. If you want to find more great healthcare IT content like this, you can find it at healthcareittoday.com or search for Healthcare IT Today and the CIO podcast on your favorite podcasting application.